Welcome to the April board meeting of the Louisville Metro Board of Health. As always, this meeting is being streamed live on Facebook and is a virtual only meeting. Now that Easter and spring break are behind us, hard to believe, I want to ensure that, as I mentioned in my note to you, that you are not dealing with damage from the recent tornadic weather, and that any damage you may have incurred is speedily remedied. It's a symbol that strong storms and unexpected weather phenomena are changing environmental factors. Strategic vision, innovation, use of advanced technology, and system redundancy are key to successful future outcomes and contribute to leaving the next generation with better outcomes. That said, we'll begin this meeting with approval of the March 2024 board meeting minutes, and then we'll open our prospective session. If our speaker, and I'm trying to look on the board here, for speaker to join, we'll do business until we until the speaker comes. So let's go forward with approval of the March 24 board meeting minutes. They were circulated in your pre-read materials, so I look to you guys to let me know if you have comments, edits, etc. And if not, the chair will entertain a motion to approve those.
So moved. Or second.
Second.
Okay. All those in favor, aye.
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 Opposed? Abstentions? The minute passed. The minutes of the March meeting are approved. A couple notes for your calendar, guys. Our next meeting will be May 1. The meeting will be virtual only. The prospective session will focus on advanced care planning and will be led by Elder Angela Overton, who is Senior Advisor to the Coalition to Transform Advanced Care, better known as CTAP. She's the founder and CEO of the Carewell Center, an Assistant Minister Pastoral Care Overseer at Burnett Avenue Baptist Church. As well, she is Associate Minister at Greencastle Baptist Church. The June 5th meeting, its prospective session, will address food as medicine and will be led by Dr. Ted Smith, Associate Director of the Christina Lee Brown Environ Institute and a professor in the University of Louisville School of Medicine. The July meeting, a virtual meeting, pending your approval, will be July 10, not July 3rd, because hopefully all of us will be enjoying a long holiday. The July meeting, as always, will be a short one, and I hope I'm not jinxing it, dedicated solely to the election of officers and any other business items that require a board vote. So I encourage you, as you did today, to log in early, and we'll proceed with at least this chair is passing the baton to a very able leader. As always, there will be no August meeting. Therefore, the next meeting scheduled will be September 4, pending the new chair's approval. Does the board have any other action items given your schedules, that should be considered at this juncture? Okay. Now, let me ask, do we have someone from Vision Zero on the screen?
Yep. Hi. Good morning.
Hey, good morning, Claire. How are you?
Good. How are you this morning?
Great. In live, upfront, close. We love it. Thank you so much. And hopefully you didn't have any trouble logging in. So let us proceed. Vision Zero is the topic for this perspective session. We'll be addressing public safety as a public health issue. Our perspective session explores and provides perspective on Vision Zero Louisville. Vision Zero, an internationally recognized program, was born out of a 2022 collaborative partnership among Louisville Metro Government, Louisville Metro Police Department, the Kentucky Transportation Cabinet, and the University of Louisville to reduce traffic fatalities and serious injuries. If you've driven down Bardstown Road, headed downtown, or Frankfort Avenue to and from downtown, or seen a rise in the number of roundabouts, those are all changes intended to reduce traffic fatalities to zero by the year 2050. Claire Yates, the Collaborative's program manager, will provide background, progress, and insights gleaned thus far from this impressive initiative. Angela Graham, Executive Administrator, Policy and Research from the Health Department, is joining Ms. Yates. Related materials have been included in the board meeting pre-read. Ms. Yates and Ms. Graham will share their perspectives for no more than 20 minutes, which will be followed by 10 minutes of Q&A or more if there are additional comments. It is my pleasure to yield the floor to Ms. Yates and Ms. Graham. And I believe they have a PowerPoint, Arlena or Catalina, for us to follow.
Do you want me to share screen?
That would be great.
Okay. Yep. I'll share screen, and Angela can just tell me next slide because
Okay, great.
we'll be co-presenting. Thank you.
Thank you, Claire.
Thanks.
Or as I would say, Ms. Yates. Perfect.
Okay. Can see that.
Yes, ma'am.
Great.
Okay, board, can you all? Yes. Okay. The floor
Great.
is yours.
Excellent. Thank you. So good morning. As Heidi mentioned, Vision Zero Louisville is a transportation safety initiative that began in 2022. And my name is Claire Yates. I am a transportation planner in Louisville Metro Public Works and the program manager for Vision Zero Louisville, handling the day-to-day operations. Angela, would you like to introduce yourself a bit more?
Yeah, thank you. I'm Angela Graham, Executive Administrator. Heidi, you gave me a bit of a promotion. My team is Research and Academic Partnerships here in the Health Department.
Well, I'm known for that. You probably
okay.
over-earned it, dear. Known you a long time.
Yeah.
Go ahead.
Angela is a rock star, though. So, as Heidi mentioned, what is Vision Zero? Vision Zero is an internationally recognized transportation safety movement. It began in Sweden in the 1990s, and really, in short, it's a paradigm shift or a completely new way of thinking about transportation or our transportation system. Instead of baking in fatalities and serious injuries, into the transportation system and just accepting, in Louisville's case, maybe 70, 80 deaths every single year as sort of quote unquote the cost of doing business. What first began in Sweden was to say, no, actually, you know what? We're not going to accept any of those deaths anymore. And we're going to transform our transportation system in order to reduce and eventually eliminate or prevent roadway fatalities and serious injuries or life-altering injuries. And so that was adopted in Louisville in 2022. And as Heidi mentioned again too, our Louisville's vision is 0 roadway deaths by 2050. Now, okay, so if 0 roadway deaths is our vision, then how do we get there? Well, we follow the U.S. Department of Transportation recommended safe system approach. It has 5 overlapping strategies that sort of act as a Swiss cheese model to reduce risk throughout the transportation system. Those 5 overlapping strategies are safer roads. So, as Heidi mentioned, the sort of Bardstown Road redesign to slow traffic and slow speeds to a safer speeds level down to a life-sustaining level. So instead of a pedestrian or cyclist possibly being hit by a car going 45, at 25, they might very well live. Safer vehicles, particularly at the federal level and the auto manufacturer level, to integrate design changes that do things like recognize pedestrians in advance and stop the brakes even before a motorist might see them. Safer people, that includes things like working with Mothers Against Drunk Driving to reduce drunk or impaired driving, and post-crash care, which is what the partnership between Public Works and Public Health was kind of born out of. And we'll talk more in a little bit. And I will turn this over to Angela.
Yeah, so for my public health colleagues here, this model should feel fairly similar. This is largely congruent with the public health approach, where we look at policies, we look at modifying systems and environments to support health and well-being and equity. We don't rely just on individual behavior all of the time or behavior change. And specifically with safe systems, we're focusing really heavily on that infrastructure to make transportation systems safer for humans to operate within. Next slide, Claire. So of course, we get into the data a little bit. We've highlighted a couple of data points here on this slide. On the right, you'll see data from the University of Louisville's hospital trauma registry, taking a look at the breakdown of what they're seeing in the emergency room and the mechanism of injury. So you see motor vehicle, motorcycle crash right up at the top, well ahead of anything else. And then on the left, you'll see some national statistics as well that just kind of highlight, what we're looking at, what we're trying to address. On top of that, unintentional injury is the 3rd leading cause of death in Jefferson County. And it's also one of the leading causes of death nationally. I think it just recently kind of got bumped down 1 notch because of COVID. But essentially, we're trying to use a harm reduction approach where we're focusing on the most serious and the fatal injury crashes rather than all crashes. And specifically, fatalities due to crashes, those are a significant component of that unintentional injury death rate that we really haven't addressed with a public health approach here in Louisville before the implementation of Vision Zero. And before our health department's involvement through Healthy Louisville 2025. And that also kind of aligns nicely, I think, with our strategy of harm reduction for another significant contributor of unintentional injury, which are overdoses. So we've talked a lot about overdose. We talk about harm reduction as an approach. This is basically applying a similar approach, but to another major component of that unintentional injury death. And I will turn it back over to Claire to talk a little bit more about the injury network.
Thank you, Angela. This map shows the inequitable distribution of fatal and serious injury crashes in Jefferson County. The high injury network is shown in blue, and the U.S. Department of Transportation defined Justice 40 areas or disadvantaged areas are shown in purple. So we know that there is an inequitable distribution of these fatal and serious injury crashes, and we also know that not all roads are created equal. Some roads are almost are basically dangerous by design, to take a Smart Growth America phrase, right? And so then we're taking that harm reduction approach that Angela mentioned. We're focusing not just on fatal and serious injury crashes, but we're also focusing on the worst of the worst roadways. So Bardstown Road in the Highlands is included in that too, right? Because in short, kind of anytime you mix a 4,000-pound vehicle with 250 pounds of skin and bone, you're gonna run into problems, particularly at speed, right? And so again, that harm reduction plays in where you're starting to reduce that risk down to a life-sustaining level. Next slide.
Thanks. So focusing specifically on post-crash care as a safe systems approach, one slice of that safe systems approach. This is where the health department kind of works with public health and our partners to own this piece of the strategy. So the key goal up here, you'll see improving survivability rate and recovery. So we're looking at what happens after the crash happens. How do people get treatment? How does emergency services respond? How do they get transported? What happens, following that? And the goal, again, looking to decrease death or long-term disability. So in order to do this, what we are aiming to do is to leverage data and epidemiology research methods to improve that survivability and reduce severe injury or long-term disability for those people who may experience some kind of collision or a crash. And that slide just kind of highlights a few of those ways that we can focus on improving post-crash care. So while public health themselves don't maybe have the authority to implement these changes or the, kind of the realm to implement these changes, our partners in EMA and healthcare can work with us to analyze the data and take a population health lens approach to help them make decisions and implement and monitor changes. And Claire is going to show and talk a little bit about our partners on the next slide.
Thanks, Angela. And speaking of partners, the good thing is we have a lot of them, right? So in Louisville, we have multiple agencies ready and willing to partner with us on this initiative, including the region's level 1 trauma centers, both for adults, U of L, and for peds as well with Norton Children's. So we would really have sort of, if you think about that safe system approach and those overlapping strategies, well, within each of those strategies of post-crash care, you really need to have even more overlappingness, right? So partnering with roadway owners like Metro Public Works and the state transportation cabinet on the infrastructure side, overlaying that with your first responders, your emergency response, and then overlaying that with your trauma centers as well, right? What is that? In the unfortunate event, if you are transposed to a trauma center, what does that care look like? What does that recovery look like? Is that recovery, or are those mortality rates inequitable as well? There's some national research that shows that as well. And so Angela and I have done a lot of groundwork over the last year and a half to grow this kind of partnership or network in order to launch the initiative when the time comes. But we see the next step as dedicating someone full time to this position to liaison with U of L and Norton Children's LMPD and EMS, and not just Metro EMS, other emergency services as well. So then lastly, if you're asking yourself, how can I help? First of all, thank you. In short, on a broad level, it would be to advocate for a public health approach to motor vehicle collisions. As Angela pointed out, motor vehicle collisions, including motorcycle crashes and pedestrians and cyclists, is one of the leading cause of trauma patient intake for our Level 1 Trauma Center for adults. And yet, currently, there's no real public health approach to that using that harm reduction strategy. Identifying funding opportunities. We're looking at a variety of different funding opportunities, including grant funding, to kind of push this, grow this to the next level. Please consider joining our monthly Vision Zero Louisville Task Force. That is a multidisciplinary, multi-agency, open to the public monthly meeting where we're able to talk about a wide range of topics that intersect with transportation safety, public safety, and public health. And then lastly, be sure to sign up for a monthly newsletter as well, so you can kind of stay in the know a bit and get clued in if you're interested in learning more on any specific topics. I'll stop sharing. That concludes our presentation.
Claire, thank you very much for the information. And quite frankly, as a person who traverses Frankfurt Avenue and Bardstown Road, and as Deputy Mayor George knows, I'm fastidiously trying to keep the drag racing or speeding through Cherokee Park in front of my home. So I think the question becomes, and I'll then open it up to the floor, to Ms. Graham, because she understands well the board's responsibility and charges. We're not an operational board. We're an advocacy board who looks to the strategy for improving health outcomes, and this is clearly one of them. So I would ask Ms. Graham, are there any needed public health related policy recommendations that fall under the regulatory statutory purview of this board, or are there policies that Metro Council is considering, or is there something that we could support if the board so desired?
I think the most pressing or the most timely thing that we have right now that could be supported is a funding request to add additional.
The board, let me interrupt just a second, if I might. I'm very good at that, so I apologize up front. The board is not charged with budgetary costs, etc. It's more advocating policy. So
yeah, thank you. We're specifically looking for advocacy in that realm because we've already made the request. So of course you are not funding it. We are looking for advocacy just to help push the profile or raise the profile of this. We really would like to be able to dedicate more resources and more time. And on top of that, I think Claire can speak to other policies or things that Public Works has planned or moving forward with that could be advocated for.
Before she offers guidance there, let me be specific a bit here. And that is, could you send me what you would like the board, specifically the policy that you would like the board to support. We could consider that by a board, and then to support it through advocacy. And I would add to that, do you all have data that shows the preliminary impact of this program? That would be critical. Any data that is out there.
Yeah, data, we certainly have. Claire in Public Works, the team has put together some really great dashboards and things that are interactive on the Vision Zero website. So I would really encourage, if you'd like to dig into that, to go check that out. And we'll be happy to send links after the presentation.
I want to be more specific, because the information that you all sent ahead of time is excellent. I'm looking for Louisville, Kentucky data.
Yep. Claire, do you have that handy to maybe share screens?
Yes, because in order to get to the council by district, by whom they represent, the best way to do that is to say, in these zip codes or in these particular areas of town, this is the impact. That means something to council members. Deputy Mayor George, I'm speaking for your past. Does that sound good?
Chair, if I may say, first of all, I just want to give a huge thank you to Claire and Angela for all their work they do every day to help improve roadway safety and elevate the needs. I think what they are proposing, and I don't want to speak for them, is really to be able to harness the collective knowledge of this group, not for the purposes of funding, but for the purposes of trying to develop a strategy for funding to make the case for why the hub and why an analyst position would effectively reap benefits both in the way of saved lives, but also costs. Understanding that this probably can't just be a council effort, right? That this is really a community effort, and we really need to see broad community support for this and creative funding strategies as it relates to being able to, again, test this idea that we all, intuitively know, which is when you provide focus to something, you have the potential both to improve roadway safety, but more importantly, in regards to this conversation, post-crash care. Thank you.
Excellent. And appreciate that. And we will get information to each board member for you to contact or send a letter of support for this to your representatives. We'll figure that out for you and make it easy for you. Question from the board. Dr. Ethels, do you have a question?
I am curious if either of you have any data or any kind of like insight into whether initiatives or changes in public transportation, so like in cities that maybe have larger bus routes or like metro railways or things like that that people can use for commuting, do those kinds of initiatives or having like a more robust public transportation system, can that lead into decreased fatalities and things like that? Or is that just kind of adding another piece to the puzzle that can, just another thing that you have to kind of manage?
Yes. Yeah, so you hit the nail on the head. I mean, basically, that's mode shift. What we call in industry speak mode shift. So basically, you're wanting to, you know, so we have the city has our you know, we have our public safety, public health, and sustainability goals, right? And so really the best way to achieve all three of those is through active sustainable transportation, which is walking, biking, or using transit, right? That's really the way to both reduce fatalities and serious injuries. It's the way to improve public health outcomes and reduce obesity rates, and it's the way to reduce greenhouse gas emissions, right? So like it's very cross-cutting in that way. And so yes, building capacity within TARC, building capacity within our bicycling community and bike initiative, all of those different things, and building out our sidewalk and shared use path network, all of those things are direct supports of Vision Zero, but also our sustainability and public health goals as well. So yeah, it's a great question.
Thank you. I believe Dr. Shaw has a question. Dr. Shaw. I don't see your name on the screen, but I think you called in. Look here. If you will just send your question to me, I will ask it. Text me, please. Just a second. He gets. Bear with me. Okay, Dr. Shaw's question was related to trauma center intake. Hang on, he's still scribing. Feel like we're a bit more primitive today, so please, everyone, including the public, bear with us. I apologize. What he says, the question was related to trauma center intake. I thought the trauma centers would have a robust way of triaging trauma patients.
Yeah, so they certainly do have a robust way of triaging patients and getting people to care. What we are looking at with post-crash care is the holistic picture of the entire chain of events, from the time that the crash occurs to the time that 911 is called, emergency is dispatched, treatment occurs on scene, the person's transported, and then gets to the trauma center. So there's a lot of different pieces in there, and a lot of different opportunities for something to go wrong or to go right. And so what we're looking at with the post-crash care approach is to use that population health lens and say, okay, not just looking at the one patient in front of you one at a time. We're looking at overall, what are those policies, practices, system variables, things that happen to go from on scene to trauma center to make sure that the person is getting the best care possible to reduce death and to reduce long-term disability.
Yeah, that's that harm reduction approach again, right? So we're going to try to do everything we can through roadway design and safety features to prevent a fatal or serious injury crash from happening in the first place. But then if it does, we want to continue to reduce harm throughout the life cycle of that crash. I believe someone had their hand raised as well. Thank you.
Did someone agree? Yes, ma'am. Dr. Severa.
Thank you. Claire, and following the question and Dr. Eccles, you have talked about increasing capacity of public transportation and Vision Zero and many other partnerships. And I now see clearly what Deputy Mayor George was speaking about, one person being the liaison of this. But I just wonder, have you started already developing those relationships, trying to approach not only Vision Zero, but the whole thing, increasing transit, increasing the Vision Zero goals and everything else that is needed?
Yes. So within the post-crash care initiative, we do have pretty good relationships with trauma surgeons and injury prevention and wellness folks at Norton Children's and U of L, and then LMPD as well. But I eventually, so Vision Zero is kind of just in its infancy, right? Eventually, Vision Zero kind of becomes a broader movement because I'm just one person and Angela is just one person, and so we can't solve this problem, and I'm a staff person, like I can't tell TARC to improve their bus routes and make all of their stops ADA accessible and improve frequency on the busiest routes and collect data and do all of those sorts of performance improvement things that they know that they need to do with adequate funding and adequate staff and talent. So, it really becomes sort of everyone's responsibility and everyone's should be everyone's goal to improve safety throughout the community and across the transportation system.
Thank you for this answer. It gives me a better and clearer image on where we are and what we need to do.
Thanks.
Another reason why it's important for us to be able to contact our individual representatives out there. But as well, I would say to Ms. Yates, we have Dr. Hargett, who is on this call, representing the Greater Louisville Medical Society. So there's some good contacts here to join in this process and to have your very, very good materials, which they could distribute and with a particular ask. So I would commend a conversation with both the Kentucky Nurses Association, and that's Delano Manson, who is also on this call, as well as Dr. Lewis Hargett, who heads the physicians in the community. And there is the chief nurse, Ms. Manson. Our question. Anything else?
I see a couple of questions in the chat. If we want to, there are no other.
Yes, please go to that. If somebody will do that, I would sort of drop on the call if I tried to do that.
Sure. It looks like there was a question earlier about whether language access had been considered. And I'm not sure if there was any specifics to that, but I do know there's been some language or translated messaging and things like that related to transportation safety Vision Zero as it applies to that public messaging component.
There's some folks on that I'm getting a note from. If you could give a link to sign up for the newsletter. Thank you.
And then Deputy Mayor George asked for examples of practice improvements that we could expect with enhanced post-crash care. There's been a little bit of work already done to link data across multiple systems to take a look at where we're experiencing the worst injuries or the worst outcomes from crashes. That was done at University of Louisville Speed School by Dr. Kluger, and some others there. And so they did kind of an initial, like, can we connect data from the health systems, from Kentucky State Police, from EMS and others to try and sort of triangulate what's going on when someone experiences a crash, and then what does the injury look like and what do their health outcomes look like. So from that, they were able to kind of identify some of the worst intersections or worst segments of roadway where people may be able to or may be experiencing, poor outcomes. So one, that's sort of a proof of concept, right? So one thing that we might be able to do with a more robust data linkage and an ongoing data linkage is to monitor what happens as some of these other transportation system improvements happen. So as we, put in a roundabout or we reduce speeds through a certain segment, do we see better health outcomes in terms of the what happens if people do experience a crash? Do we see better survivability rates? Do we see better disability or lower disability long-term injury rates? So that's one thing that we can do, sort of monitor how the rest of Vision Zero is going in terms of that health outcome. And I think, it's one of those things where you kind of open up the Pandora's box once you start linking that data and you see what you can see, and working with our partners and showing, hey, this is like what we're seeing in the data. What does this look like to you? And then they, are able to identify a practice or a policy change or something in the way that they dispatch from EMS or something, those types of things. I expect it to be sort of an ongoing hunt and find kind of exercise to see what we can improve as we move forward.
Yeah, I mean, one of the biggest ways that we prioritize limited resources when it comes to roadway projects is to use historical crash data. Well, that historical crash data, those collision reports, come from law enforcement, and while the fatality data is almost certainly 100% accurate across the board, whether that be from the medical examiner's office or coroner's reports, medical examiner's office, or the collision report from the on-scene officer. But the rates of suspected serious injury, so again, things like broken or distorted extremities, crush injuries, suspected skull, chest, or abdominal injury, significant burns, paralysis, things like that. We know from research across the country that that sort of brief snapshot in time assessment of whether or not that person is experiencing a traumatic or serious injury, that accuracy is roughly 50%. And so what if through ongoing data linkage and injury surveillance, we can improve that from 50% to say even 80%? My goodness, that the robustness and accuracy of that collision data would be phenomenally improved, and that would help reaffirm to leadership, hey, we know with a much higher degree of certainty and confidence that we are investing very limited dollars on this road because we have all of the facts, we have all of the data to the greatest extent that we can, right? That's what really kind of moves the needle.
Very much. One more question. Okay. Ms. Yates, enlightening. Absolutely enlightening, at least speaking of personal privilege, from my point of view. I now understand. I thought it was rather crazy to wake up one morning and drive down Bardstown Road and have the road do something different. But now know, and keeping up with this technology and what's available is quite amazing, and it obviously saves lives and improves the future transportation safety of our community, because it's that advanced technology and innovation and data that will make a positive difference in health outcomes for residents in the Metro Louisville area. We thank you and look forward to getting some additional information, and colleagues, we will distribute that as part of the post-meeting notes. Thank you so much for joining us, Mrs. Yates and Ms. Graham.
Thank you all very, very much. Thank you, Chair.
Okay, now on to business consideration. And with that, appropriately, Deputy Mayor George, you're next, and the chair recognizes you for an update from the mayor's office and any other requests.
Well, good morning. I'm really happy to be here. I would defer to the public health team to provide updates and want to make best use of time. So thank you.
Okay, all right. And from another point of personal privilege, thank you for your efforts with the motorcycles in Cherokee Park drag racing on the hills across from where I live. And while they still go on, it's my understanding from my neighbors that several people have been arrested. So there is some enforcement going on, but it does continue. And given this conversation, I think it's of primary importance, and I'm sure that's true for all the beautiful parks in this community. And given our weather, and now given Derby, all the more important. So thank you. All right. Then we will, the chair yields to interim public health director, Connie Mendel, followed by the interim medical director, Dr. Inder Single, if he is available. And you have a copy of Ms. Mendel's report that came in your pre-reading materials. And so she will speak to priority issues, especially those occurring going forward over the next time between our interim director.
Thank you. Good morning, Madam Chair and board and guests. As Heidi pointed out, there is a copy of the Board of Health report in your materials. I want to point out specifically our community health assessment is ongoing. There's a link to that in your materials. Please complete that as the partner survey, as you are one of our partners, and share that with your partners. We want to ensure that all of the community is represented in our assessment. So we want to be able to include all of our residents across Metro Louisville. So please share that widely. We strive for this report, which will be Healthy Louisville 2030, to help meet the needs, public health needs across the community. So this is a really big endeavor that we're on taking. And then further down in the report, you'll see some information about our vector control program. So currently we are kicking off mosquito control season. So you'll see our teams out doing pre-treatment, trying to prevent mosquito-borne diseases like West Nile and others. But also we have a spotted tick program, spotted tick, share a tick, where we will actually collect ticks and test them for tick diseases. So we'll identify the species and look for things like Rocky Mountain spotted fever, Lyme disease, which has increased in our area. When I began my career, Lyme disease was not something that you found in Kentucky. And also other tick diseases like ehrlichiosis and numerous others. So our environmental team, including the laboratory, just does fantastic work. So there's information there on how you could share those if you come upon a tick. And lastly, I want to share a little bit of information. It's not on the report, but will be forthcoming about youth vaping. We continue to see an increase nationally and locally in youth vaping. Very concerning, has replaced cigarette smoking in a lot of areas. So our environmental team is working along with zoning and ABC officers to ensure that tobacco products and vaping products are not sold improperly. So any type of business has to apply for a license, and these new businesses are not able to be too close to one another. They're not allowed to be too close to child-oriented businesses like parks, community centers, churches, schools. So this is all based on changes to Louisville Metro Ordinance, thanks to Metro Council and others for creating these smoke-free or additions to our smoke-free ordinance. So this includes tobacco sales, but also e-cigarettes and paraphernalia for both. So a lot of work going out with our team to improve monitoring, to improve enforcement, ensuring that these businesses have the right licenses and they're operating legally, and also not selling to anyone under 21 years of age. So more information will be forthcoming on that. I just wanted to provide you all with some awareness of that now, and then we'll look for ways that we can work together to prevent or stop youth vaping.
Thank you. And she may have already left. Delano Manson had a report and had to leave because she has another meeting, and I think she already dropped off. Yes. Okay. The chair now recognizes Dr. Irwin for a very brief update on family health center actions, and Ashley Shoemaker for the Medicaid coverage and coalition update.
Yeah, thank you. I'm happy to announce that the property at 2215 Portland Avenue, which is home to the U.S. Marine Hospital and to Family Health Center's largest and oldest site, has been successfully transferred. The ownership has been transferred from the Board of Health to Family Health Center. So that was effective as of a couple of weeks ago. So thanks to Chairperson Margillis for her help, and also County Attorney employee Natalie Johnson for their assistance with the transfer.
Ms. Shoemaker?
Yes, the next coalition meeting is scheduled for Monday, the 15th. Due to a scheduling conflict, it was rescheduled for next Monday, the 15th at 4 o'clock. We are in the tail end of the Medicaid unwinding and are looking forward to a return to normal. And we'll also be discussing strategies that the state is taking to reinstate coverage for people who were incorrectly terminated. So lots of good news there, but that next meeting is coming up on Monday.
The chair has a slide comment about, I don't know that any government entitlement program has had anything positive said to preface it, as in good news. So that is good news, and thank you for sharing, and thank you for your work with the coalition. It's an impressive coalition serving the most vulnerable in the state. Appreciate it. Let's see, where are we here? All right. The chair also goofed up. Delano Manson was going to give us our report on the Kentucky Nurses Association, but we'll include her update in your follow-up materials as mentioned. Dr. Hargett, you're up.
Say, Dr. Hargett?
Yes, sir.
Okay. Yes. I wanted to give an update as what's going on with GLMS. We had the National Doctors Day, which was March 30th, 2024. All the hospital systems during the course of that week recognize physicians for their service to the community as well as their hospitals. Matches Day, which is a big deal for the fourth year medical students at U of L. This occurred on March 15th. U of L had I'll say the students were very happy with the places that they were getting for their residencies, and to know that they're going to be moving out of U of L into bigger and better things is the graduation. And then the last thing is that the GLMS just had their elections. It closed at the end of March. And so we're currently tabulating and getting the information as to who's going to be the new officers for the Greater Louisville Medical Society coming up. The transition takes place in May. I'm currently president-elect, and I'll be installed as the president in May. And so the new office will be officially put in place at that time also. So those are the updates.
Thank you so much. We'll call you King Hargett. How's that?
Okay.
You have a heavy task. I think I neglected to introduce Dr. Cardarelli, the new representative to the board for the School of Public Health, who comes from us from the University of Kentucky. And very proud to have her. Know she will be an effective member, advisory board member for all of us, and just thrilled. Did you want to say a few words?
Certainly. Well, yeah, I'm on day 3 now of this new role. I am exceedingly excited to work with all of the great folks here at the University of Louisville, but I am equally excited to work with all of you all to focus on the health of the community here in Louisville. I'm a native Texan, but we have been in Kentucky for almost 11 years now. And so I'm just very excited to be here, and will likely be a quiet listener for a while as I learn the ins and outs of the board and Louisville metro area. I'm an epidemiologist by training, which is why you saw my comment earlier. I love data, and that will certainly help me get to know the area. But please don't hesitate to reach out if there's anything that you need from the School of Public Health.
Thank you again, and thank you for calling the university home. Let's see. Advisory board, community advisory board. Are there any other reports? Dr. Smith, anything?
Nothing for me.
Okay. Anybody else? Okay. Is there any old business to come before the board? Is there any new business to come before the board? Okay. As mentioned at the beginning of this session, our next meeting will be May 1, I guess, May Day. The perspective session will address advanced care planning. And for this chair, it's a countdown to passing the baton. Our elections are in July, and so encourage all of you first to come to the May, June, July meetings. And as you know, the July meeting will be a short one. Thanks, last words again. Anything else? Chair will consider a motion to adjourn.
Move to adjourn.
Okay.
Second.
Any objection? We stand adjourned. And as always, stay and be well. And mega thanks for active participation and conversation, suggestions for future speakers. I don't like to speak for other people, but I'm sure Dr. Bautista Severo would love to have some suggestions as well. I want to thank her for being my partner here, and look forward to her leadership as a result of the July meeting and pending your votes. Meeting stands adjourned. Thank you so much.